And then the thing that we use in our office to kill the pathogen directly, we use the Rife machine. Has anybody heard of Rife technology before? So I started using Rife technology about 15 years ago. I've studied, this has to do with light frequencies. So, real quick, brief rundown. I am not a physicist, so don't ask me too many technical questions. But all matter, everything that you can see, down to its smallest particle, is simply energy that's vibrating at a specific frequency. That's what quantum physics teaches us. So, Lyme disease, those pathogens, all the co-infections and the Borrelia, are also vibrating at a specific frequency. If you can hit them at their own frequency, you can help kill them. Okay? You can help the immune system detect where they're hiding. So this is called energy medicine. I started studying this about 20 years ago, maybe 25 years ago. I didn't buy my first Rife machine until 15 years ago. Because at that time, the whole information about the Rife was solely for treating cancer. The Rife is named after a guy, Royal Raymond Rife, back in the 40s and 50s. He did work on light frequency to help kill cancer, and he treated cancer patients, and the University of Southern California School of Medicine used to send him all their terminal cancer patients. That was really before they started using chemotherapy, so they didn't know what to do on these cancer patients. As soon as chemotherapy came into advent after World War II, then the AMA passed laws that you could not treat cancer unless you were using pharmaceuticals, and all the cancer clinics that were using nutraceuticals, nutritional natural substances, were shut down. Literally overnight, chains on the door, you're kicked out of the country. That's where the Mexico cancer clinics came into being, because many of those people, like Pearson and Hoxie and such, moved down to Mexico, where they were free to practice the way they wanted, and they practiced a nutritional therapy. Rife didn't go to Mexico. He just gave up the ghost. He literally died an alcoholic, living with his sister. I don't think he was ever married. And all his technology was lost for decades. Until actually the federal government Defense Department picked up his technology and tried to use frequency medicine to induce disease. And they actually did us a wonderful favor, because they mapped out the quantum physics frequencies of every disease known to man. Which is what a blessing, because in the Freedom of Information Act, it all became public. So then we were able to use that with using Rife technology to help people get better. So it's a blessing. So all the information on Rife technology, though, 20 years ago was on cancer. Chronic Lyme wasn't even really in the crosshairs at that time. So I didn't have any cancer patients at the time. But I knew God was just telling me, you're going to get a Rife machine, you're going to get a Rife machine. So I was studying about it. I actually had the picture of the one that I picked out, and I did my research with, this was the best one in the market right now. This is the one I wanted, up on the wall at in front of my desk at my office. Until I had a patient, who was actually a chiropractic patient, come in and say, I have to talk to you right now. She looked like she had terror in her eyes. I pulled her in the room. She goes, I have breast cancer. It's in both breasts. The doctor said it's the worst kind you could get, and if I don't do chemo and radiation, I will be dead in 3 months. That's what they said. And I said, okay, and what do you want me to do? And she goes, oh, you don't get it. I'm not doing the chemo and radiation. My friend died of chemo 5 months ago. I'm not doing it. I would rather die. If you can't help me, I'd rather die. And I just knew right then, the Holy Spirit said, now. I said, Char, I'm getting a Rife machine. Don't even ask me what it is. You got to come down every day and do it. And she said, fine, just tell me what to do. She's still alive today. So since then, that brought me into the whole journey of treating cancer patients. That's when I quit chiropractic, went back to school, got a degree in functional medicine, integrative cancer therapy, and that's my main piece of my focus. And then we started getting Lyme patients about 10 years ago. And then we got into this whole autoimmune piece, and I figured that out, thanks to the Lord, on how we started this whole road. So the Rife has been a blessing. But the Rife has to be the correct type of Rife. It has to be light frequency. So we use a brand called True Rife. I think I got a picture of it here. That's what we use for all our patients. So if a cancer patient comes to us now, or a chronic Lyme patient comes to us now, or we have patients that don't know what they have, at least once a week, that fly in from New York or wherever, and they've been everywhere, nobody can figure out what they have. If they have a pathogen, now understand, an antigen is that which the immune system is turned on against. So an antigen, that which the immune system is turned on against, doesn't necessarily need to be a living organism. It could be like heavy metal toxicity. They have an autoimmune disease, and mercury is the antigen. Well, they don't need a Rife machine then. So we don't use a Rife machine with those patients. But if you have cancer or a biotoxin, like Lyme disease, that's in an autoimmune phase, that's where a Rife machine is in order. So our patients come to us, they're with us 2 full, complete days, testing and scanning them on what frequencies are going to work with them. I personally write their program, and they go home with the Rife machine that they're using every night while they're sleeping. So unless that cancer patient or Lyme patient is an invalid and in a chair and never gets up and does anything, I want them living during the day. That's my philosophy. I want you to identify with Lyme disease and that you have Lyme disease for the rest of your life. Not that you don't necessarily have Lyme disease yourself or cancer the rest of your life, but I want you to live. I don't want this to be your identity. Nobody better have a Lyme tattoo here. Okay? You don't want to identify with this. You want to not stick your head in the sand. You want to realize, I got to do something about it. Make the steps to do something about it. Ask for wisdom and walk in that wisdom and be obedient. And trust that God's going to heal you. So we use a Rife on every patient that is a chronic Lyme patient. That's a much more expensive program. So a person that's in a chronic stage, not in an autoimmune stage, often can take care of their problems. My daughter does not have a Rife machine. Can take care of their problems, in their flare-ups with herbals. Because they're not in a Th1 dominant stage. They're not in an immune phase. She gets flare-ups when she's under stress, she travels a lot. That's why, because her whole immune system drops. So the Lyme takes off and starts reproducing, and she gets sick and gets a flare-up. She takes some herbals, it stimulates an immune response, knocks the Lyme down, and she's fine within a day. She forgets the herbs in the hotel room or whatever, and she calls me a year later. What was I supposed to take again? I said, Jesse, you better write this down on your phone because I'm not going to be around. That's your life to tell. But she takes astragalus and garlic and some other things that I tested her out on and knocks it out right away. She doesn't need a Rife machine. We use a Rife machine at home. My wife and I use a Rife machine. She had some skin cancer that we dealt with, and we still use a Rife machine every night. Still doing okay? So that's what the True Rife is. You can go on their website if you want. I think it's on our website, some information on it. But we use the True Rife. And they see with that camera bulb. That's the only picture I can find of the camera bulb up there. It's about a 24-inch bulb that has a faint pinkish purplish light. Remember, I'm programming the frequencies that are going into that. Now, I've said at the beginning of this lecture that Lyme patients are 10 times harder than my cancer patients. And I say that a little bit of tongue-in-cheek, but a lot of sincerity, because a cancer patient, you can figure out the frequencies that they need to kill that cancer. See, cancer is your own cells that aren't going through normal programmed cell death. The apoptosis are in a rapid replication phase. There's a reason for that. We can usually figure that out. We can solve that reason, and we can program the Rife for that cancer. We can usually figure out the right frequencies to use, and that patient gets better. Most cancer patients come to us late stage 4. Nobody ever calls us and say, hey, I just found out I had cancer, can I come see you? We did have one person, he was a doctor from southern Minnesota that did that, ironically. But Lyme pathogens are pathogens that are living organisms. They're biotoxins. And they want to do one thing: survive. So the Lyme bacteria and their co-infections, all they want to do is survive and have babies. That's what they want to do. They want to reproduce and they want to live. So when you do things to try to kill them, they have this wonderful, for them, innate ability to morph their frequencies. That's how they stay alive. That's what a MRSA infection is.
MRSA?
Yes. A chronic infection in the hospital where they give them antibiotics, and now this infection is antibiotic resistant. It's because the frequency, it morphed its frequency. It's a different organism almost. Not yet named, but it's acting like a completely different organism because it's functioning under a different frequency. So with the Rife program, we have to write sweep programs, so it sweeps through frequencies. It's a pain. And you have to change that person's program pretty regularly as that thing starts to morph. So it's a lot more work.